In today's world, fentanyl is one of the leading causes for overdose, and in the United States, it is important to be educated on what the risks of fentanyl are and how you can avoid them. Fentanyl is becoming a very common drug in our community and is being laced into other drugs. Even if you aren't doing fentanyl, you are still at risk of being exposed to it. Today, I would like to educate you on what fentanyl is and how much it takes to kill you, and the dangers of fentanyl lacing. What is fentanyl? According to the National Institute on Drug Abuse in 2021, fentanyl is a powerful synthetic opioid similar to morphine but 50 to 100 times more potent. In January of 2024, in the American Addiction Centers, they published an article that states, side effects of fentanyl and the dangers of fentanyl and misuse of fentanyl can include but are not limited to hallucinations and verbal or visual disturbances, drowsiness and nausea, confusion, constipation, respiratory distress, muscle rigidity, unconsciousness or sedation, seizures, and even overdose. Fentanyl carries a very high risk of overdose because it is lethal in such amounts. Synthetic opioids, which include fentanyl, are currently the main driver of overdose deaths in the United States. Fentanyl's high level of potency greatly contributes to the risk for overdose and other adverse reactions. According to the Department of Justice Drug Enforcement Administration in 2020, fentanyl was first developed in 1959 and introduced in 1960 as an intravenous anesthetic. According to the Centers of Disease Control and Prevention, an article states there are two types of fentanyl, pharmaceutical fentanyl and illegally manufactured fentanyl. Both are considered synthetic opioids. Pharmaceutical fentanyl is prescribed by doctors for severe pain, especially after surgery or advanced stages of cancer. An article published by the UMass Chan Medical School in 2022 says fentanyl is both sold alone and often used as an adulterant because of its high potency and allows dealers to traffic smaller quantities but maintain the drug effects that buyers expect. Manufacturers may also add bulking agents like flour or baking soda in fentanyl to increase supply without adding cost. As a result, it is much more profitable to cut a kilogram of fentanyl versus a kilogram of heroin. The University of Boulder in 2023 states fentanyl is often mixed into other substances or marketed as other substances, such as prescription medications. This can be dangerous because individuals often consume fentanyl without even knowing it. Drug traffickers often mix fentanyl into other drugs because it's cheap to manufacture and a small amount goes a long way. Experts consider 2 milligrams of fentanyl to be lethal, but many counterfeit pills contain up to 5 milligrams of fentanyl, over twice the lethal dose. The United States Drug Enforcement Administration published an article in 2023. According to the CDC, synthetic opioids like fentanyl are primary driver of overdose deaths in the United States. What is harm reduction and overdoses? The U.S. Department of Health and Human Services published an article stating evidence-based harm reduction strategies minimize negative consequences of drug use. The Nevada County Health and Human Services says fentanyl and fentanyl analogs, some stronger, some weaker, are not Narcan resistant. These opioids will respond to Narcan if someone is overdosing. The opioids, according to the National Institute on Drug Abuse in 2021, an overdose occurs when a drug produces serious adverse effects and life-threatening symptoms. When people overdose on fentanyl, their breathing can slow or stop. This can decrease the amount of oxygen that reaches their brain, a condition called hypoxia. Hypoxia can lead to a coma or permanent brain damage and even death. The Health and Wellness Institute at University of Colorado Boulder states Narcan is an FDA-approved medication that can be used to temporarily reverse opioid overdoses. Narcan is typically administered through a nasal spray, but also comes in injectable forms. This medication can temporarily reverse opioid overdose, but it can wear off quickly and require additional doses for fentanyl. In conclusion, fentanyl is a very dangerous drug and can affect people that aren't even directly taking fentanyl. It can be laced into other drugs and can cause extreme side effects and more commonly death. This is a leading cause in today's world deaths, and there are ways to avoid these outcomes. There are harm reduction strategies to ensure that you are not exposed to the lethal amounts of fentanyl. Fentanyl is everywhere, and if it's not affecting you, it's affecting someone around you. Being educated about the risks of fentanyl could save someone's life. Thank you.